Hey everyone, welcome back to the Healthy Cuties. This week we're talking more about health informatics. We will cover 2 articles, give our insights and thoughts, and then we'll share what we learned.
Our first article is titled The Impact of Information Technology on Patient Engagement and Health Behavior Change. In this article, we will be addressing the importance of patient engagement and them becoming more proactive in their treatment process. Smoking, obesity, poor blood sugar and pressure, inadequate exercise, medical non-adherence, and skipping medical appointments cause 40% of deaths in the United States. These deaths are preventable and due to a lack of patient engagement. With patient engagement, doctors and clinicians are able to monitor patients remotely at a lower cost compared to traditional point-of-care based methods. Moreover, in becoming more engaged with their treatment, patients are more encouraged to adopt a healthier lifestyle, attend their appointments, adhere to prescribed medication, and become more knowledgeable about their disease and treatment.
From the study, researchers were able to find data relating to the impact of IT platforms on health outcomes. They discovered that 89% of patients found that there was a positive impact on using IT platforms for health. Between internet-based programs and applications and real-life results, there was a high correlation. For example, social media showed positive impacts on health because it acted as a good platform for sharing experiences, discussing treatments, and more. The treatment that showed the largest positive impact was video game implementation at 100% positive impact. Researchers found that it helped not only build client-therapist relationships, but also improved patient engagement in the therapeutic process. Overall, the study concluded that there is a significant correlation between the use of IT platforms and patient engagement in healthcare.
Overall, there were 4 principal findings within the study. First, it was discovered that information technology platforms have a large impact on patients' health outcomes. It not only encourages behavior change through patient engagement, but also enables patients to be health aware and independent in monitoring their own health. Next, mobile phone tech and web-based platforms ensure delivery and sharing of information among patients. Because they are usually less expensive, they are more accessible to patients, and they facilitate engagement. The lack of consistency in follow-ups has a possibility of skewing the results and determining if IT platforms had positive impact or no impact at all. This is because interventions needed to be assessed. For example, the length of intervention, type of tech, usability of the tech, application of behavior theory, and how health outcomes are all measured must be taken into consideration. Lastly, it was noted that higher patient engagement conditions self-management, which in turn creates greater improvements in health outcomes. In this article, we learned that researchers at the University of California, Irvine developed a wearable respiration monitor using the beloved children's toy Shrinky-Dinks. Aimed for kids with asthma, cystic fibrosis, and other chronic pulmonary conditions, this device allows the user to go about their daily lives easily, while vital information is sent to the smartphone apps via Bluetooth. The data can then help warn conditions such as asthma attacks. With this device, users can go about their daily lives while collecting information about their respiratory health.
4 key components made up the process in which this wearable respiratory monitor was made. First, a thin layer of metal is applied to a Shrinky-Dink sheet, which is a toy composed of small thin plastic sheets that can be shrunk via heat to make it sturdier. After the metal is applied to the sheet, it is then corrugated via heat. The corrugated film is then connected to a small stretchy material similar to a bandage. Finally, the device is then adhered to the patient. These sensors that is on this device send signals that can be communicated with a smartphone app via Bluetooth.
Michelle Kine is a professor of biomedical engineering at UCI whose lab developed this device. She said that she was inspired to create this respirator due to her son's experience in the NICU, or neonatal intensive care unit. She said, quote, "Despite having his whole tiny body covered in sensors, all the hospital staff could get was respiration rate information. It looked like they were getting information, but they weren't." End quote.
As a mother, Michelle Kine's case captures the value and benefit of integrating technology in the medical field. She is able to humanize the use of technology development in a very effective, unconventional way. Also, in being able to relieve parents' emotional burden and financial strain, the practical application of this technology becomes more appealing to its users.
I liked how the first article explains some of the possible biases in their study. It shows that the article is aware that some of their results may not be completely accurate.
Even though the findings may have been like a little bit exaggerated, I think that having patient engagement through technology is a very important aspect to improve overall healthcare. For the second article, I am very surprised that a children's toy can be used to develop healthcare purposes. I believe that we should be open to more unorthodox methods and materials because the solution could be something as simple as a children's toy.
In promoting patient involvement, treatments become more viable and effective. I find it revolutionary how IT platforms empowers its patients to be more proactive and allows for more self-representation in their treatment. They are more knowledgeable and able to better communicate and discuss their treatment options with their physicians, even sometimes questioning unnecessary methods. However, I believe there would be some issues with patients being motivated to routinely track their health. Going forward with IT platforms, the issue for most users will be interpreting the tracking to be an interruption of their daily life.
So for me, I found the first article to be the most informative and the most lengthy. It showed me how having patients engage in monitoring their own health encourages health awareness and independence. I think knowing that patient engagement increases with the help of infotech illustrates the impact of technology in the health industry. The second article was fascinating in how researchers can be so innovative as to use shrinky dinks to make medical devices. It really shows how complex problems may require modern and simple solutions, so simple as to even using a child's toy. I think this can act as a basis to encourage researchers and engineers to think outside the box and develop unique solutions to many problems.
Hi! So, for the first article, I think the team did a really good job at trying to minimize bias. However, it can't be completely objective. Even with two investigators, they could share the same beliefs, and therefore there could be some bias within that. And then, even though the alternative would be to use an algorithm that's still biased, like how we discussed last week, there still could be bias when you're creating that algorithm. So therefore, I think it's kind of sad that it can't be 100% objective, but I still think the article is pretty valuable. I also thought that the second article was really interesting because not only did the invention occur at UCI, but it's also made using shrinky dinks. I think it's pretty interesting to see them being used as like medical devices and in a more productive manner than just toys for kids.
So what we learned today is that technology can help bridge the gap between patient and healthcare providers. Web applications, mobile apps, and social media are viable ways to engage patients in improving health behaviors. Michelle Kine's lab created a platform for medical applications using a children's toy shrinky dinks.
By incorporating technology in a low-profile way, patients are more likely to use the technology. Moreover, there is a broader range of patients that the technology can be applied to, such as infants and newborns. These groups are the most difficult to address as they are very sensitive to their environment. Moreover, the appeal to a humanistic value such as parental care allows technology to be more easily accepted and integrated into the medical care system.